Hello guys, I hope you guys doing good. Today we're gonna talk about 10 NCLEX questions with rational answers. If you guys are currently preparing for your NCLEX exam, make sure you subscribe our channel because we're about to smash the NCLEX exam and it's just the beginning. The nurse is caring for a client who is receiving blood transfusion therapy. Which clinical manifestation would alert the nurse to a hemolytic transfusion reaction? Select all that apply. Headache, tachycardia, hypertension, apprehension, distant neck pain, a sense of impending doom. If you haven't answered yet, you may want to pause the video. Well, first you gotta focus on the subject, a hemolytic transfusion reaction. Recall the pathophysiology of this type of reaction to select the correct option. A hemolytic transfusion reactions are caused by blood type of Rh incompatibility. When blood containing antigens different from the client's own antigen is infused, antigen-antibody complexes are formed in the client blood. These complexes destroy the transfused cells and start inflammatory responses in client blood vessels, wall, and organs. The reaction may include fever and chills or may be life-threatening with disseminated intravascular coagulation and circulatory collapse. Other manifestations include headache, tachycardia, apprehension, a sense of impending doom, chest pain, low back pain, tachypnea, hypotension, and hemoglobinuria. Question number 2. A client has an arteriovenous AV fistula in place in the right upper extremity for hemodialysis treatments. When planning care for this client, which measure would the nurse implement to promote client safety? Use the right arm for blood pressure measurement. Use the fistula for all venipunctures and intravenous infusions. Ensure that small clamps are attached to the AV fistula dressing. Access the fistula for the presence of a bruit and a trill every 4 hours. Focus on the subject, AV fistula and safety. Eliminate option 3 first because this refers to care of an AV shunt in which there is an external cannula that can become disconnected. Blood pressures or venipunctures or IV infusions are not done on the extremity with the fistula because of the risk of clotting, infections, or damage to the fistula. AV fistula are created by anastomosis of an artery and a vein within the subcutaneous tissues to create access for hemodialysis. Fistula should be evaluated for the presence of thrills and bruits as an assessment of patency. The only option that relates to the subject of this question is option 4. Question number 3. A client diagnosed with both a wound infection and osteomyelitis is to receive hyperbaric oxygen therapy. During the therapy, which priority interventions would the nurse implement? Maintaining an intravenous access, ensuring that the oxygen is being delivered, administering seductions to prevent claustrophobia, or providing emotional support to the client's family. First, you gotta note the strategic word, priority. Hyperbaric oxygen therapy is a process by which oxygen is administered at greater than atmospheric pressure. When oxygen is inhaled under pressure, the level of tissue oxygen is greatly increased. The high level of oxygen promotes the action of phagocytes and promotes healing of the wound. Because the client is placed in a closed chamber, the administration of oxygen is of primary importance. Although option 1, 3, 4 may appropriate interventions, but option 2 is the priority. Question number 4. A client is scheduled for hydrotherapy for a burn dressing change. Which action would the nurse take to ensure that the client is comfortable during the procedure? Ensure that the client is appropriately dressed. Administer an opioid analgesic 30 to 60 minutes before therapy. Schedule the therapy at a time when the client generally takes a nap. Assign an assistive personnel to stay with the client during the procedure. A burn injury is extremely painful and the client should receive pain medication approximately 30 to 60 minutes before a burn dressing change. This will help the client tolerate an otherwise painful procedure. None of the remaining options addresses the issue of the pain effectively. Question number 5. The nurse is caring for a client diagnosed with heart failure who has magnesium level of 0.75. Which action would the nurse take? Monitor the client for irregular heart rhythms. Encourage the intake of antacid with phosphate. Teach the client to avoid food high in magnesium. Provide a diet of ground beef, eggs, and chicken breast. Focus on the subject, a client with heart failure who has a magnesium level of 0.75. Recall the normal magnesium level. The normal magnesium level ranges from 1.8 to 2.6. Therefore, the client is experiencing hypomagnesemia. The client should be monitored for dysrhythmias because magnesium plays an important role in myocardial nerve cell impulse condition. Thus, hypomagnesemia increases the client's risk of ventricular dysrhythmias. The nurse avoid administering phosphate in the presence of hypomagnesemia because it aggravates the condition. The nurse instructs the client to consume food high in magnesium. Ground beef, eggs, and chicken breast are low in magnesium. Question number 6. The nurse is assessing a pregnant client with a diagnosis of abruption placentae. Which manifestation of these conditions would the nurse expect to note? Select all that apply. Uterine irritability, uterine tenderness, painless vaginal bleeding, abdominal and low back pain, strong and frequent contraction, and non-reassuring fetal heart rate patterns. Placental abruption, also referred to as abruption placentae, is the separation of a normally implanted placenta before the fetus is born. It occurs when there is bleeding and formation of a hematoma on the maternal side of placenta. Manifestations include uterine irritability with frequent low-intensity contraction, uterine tenderness that may be localized to the site of abruption, itching and dull abdominal and low back pain, painful vaginal bleeding, and a high uterus vesting tone identified by the use of an intrauterine pressure catheter. Additional signs include non-reassuring fetal heart rate patterns, signs of hypovolemic shock, and fetal death. Question number 7. The nurse is caring for a client diagnosed with a herniated lumbar intervertebral disc who is experiencing low back pain. Which position would the nurse place the client in to minimize the pain? Supine with knees slightly raised. High Fowler's position with the foot of the bed flat. Semi-Fowler's position with the foot of the bed flat. Or semi-Fowler's position with the knee slightly raised. Clients with low back pain are often more comfortable in the semi-Fowler position with the knee raised sufficiently to flex the knee, the Williams position. This relaxes the muscles of the lower back and relieves pressure on the spinal nerve roots. Keeping the bed flat or lying in supine position with the knee raised would excessively stretch the lower back. Keeping the foot of the bed flat will enhance extension of the spine and also stretch the lower back. Question number 8. A client admitted to the hospital has been prescribed pyridostigmine as a treatment for myasthenia gravis. When assessing the client for side effects of the medication, the nurse would ask the client about the presence of which occurrence: mouth ulcers, muscle cramps, feeling of depression, or unexplained weight gain. Pyridostigmine is an acetylcholinesterase inhibitor used to treat myasthenia gravis, a neuromuscular disorder. Muscle cramps and small muscle contractions are side effects and occur as a result of overstimulation of neuromuscular receptors. Mouth ulcers, depression, and weight gain are not associated with this medication. Question number 9. A client who experienced a fractured right ankle has a short leg cast applied in the emergency department. During discharge teaching, which information would the nurse provide to the client to prevent complication? Trim the rough edges of the cast after it is dry. Weight bearing on the right leg is allowed once the cast feels dry. Expect burning and tingling sensation under the cast for 3 to 4 days. Or keep the right ankle elevated above the heart level with pillows for 24 hours. Leg elevation is important to increase venous return and decrease edema. Edema can cause compartment syndrome, a major complication of fractures and casting. The client or their family may be taught how to pedal the cast to prevent skin irritation and breakdown. But rough edges, if trimmed, can fall into the cast and cause a break in skin integrity. Weight bearing on a fractured extremity is prescribed by the primary healthcare provider during follow-up examination after radiographs are obtained. Additionally, a walking heel or a cast shoe may be added to the cast if the client is allowed to bear weight and walk on the affected leg. Although the client may feel heat after the cast is applied, burning or tingling sensation indicate nerve damage or ischemia and are not expected. These complaints should be reported immediately. And finally, the last question. An adult client who experienced a fractured left tibia has a long leg cast and is using crutches to ambulate. In caring for the client, the nurse assesses for which sign or symptom that indicates a complication associated with the crutch walking. Left leg discomfort, weak biceps brachii, triceps muscle spasm, or forearm muscle weakness. Forearm muscle weakness is a sign of radial nerve injury caused by crutch pressure on the axillae. When a client lacks upper body strength, especially in the flexor and extensor muscle of the arms, he or she frequently allows weight to rest on the axillae and on the crutch pad instead of using the arm for support while ambulating with crutches. Leg discomfort is expected as a result of the injury. Weak biceps brachii is not a complication of crutch walking, but rather caused by an injury to the brachial plexus itself. Thank you guys for watching the whole video. If you guys are currently preparing for your NCLEX exam, make sure you subscribe our channel because we're about to smash the NCLEX exam and it's just the beginning.